Brown spots versus melasma, tomato, big difference. Hi, I'm Dr. Aleksandra Brown. I'm a board-certified dermatologist, and today we're going to talk about something I see all the time in my clinic. Someone walks in with what they think is a brown spot or a brown patch, but the treatment they've been using isn't working, or even worse, they went to local med spa and got an IPL and now it's worse. Why is that? And it's because it's not a sunspot, it's melasma. At first glance, melasma brown spots look very similar, but they're completely different when it comes to what causes them, the pathophysiology, how they behave, and most importantly, how they need to be treated. So if you don't know which one you're dealing with, you could waste your time, waste your money, and even make your pigmentation worse. That's why getting the right diagnosis is one of the most important steps that you can do to treat your hyperpigmentation. In this video, I want to walk you through how to tell the difference between the two, why does it matter so much, and how to treat each one the right way. So if you're into derm-back skincare tips, don't forget to like this video and subscribe to my channel. Let's get into it. Let's start with what most people call the brown spots. This is an umbrella term that includes sunspots, also called age spots, or solar lentigines, as we would say in clinic, as well as post-inflammatory hyperpigmentation, or PIH. Sunspots are caused by years of sun exposure. UV rays stimulate melanocytes, which is your pigment-producing cells, to create this extra melanin, which clumps in the upper layer of the skin and becomes a visible dark spot. These tend to be really small, flat, they can be round or oval, they have very distinct borders, and they're located in the areas that get a lot of sun, like the face, chest, hands, shoulders. They're more common with age. We see more of these as we get older because they're due to chronic cumulative sun exposure. And they're usually isolated spots. They're not large patches. Once they're treated, they generally don't come back unless you continue to get UV exposure. Post-inflammatory hyperpigmentation, or PIH, on the other hand, is a type of a brown spot that it can show up after acne, eczema, or really any sort of inflammation or trauma to the skin. The trigger here is not really sun, it's inflammation, but it also tends to fade over time with proper care. Now, if you're someone who thinks you might have post-inflammatory hyperpigmentation, you have dark marks where you used to have inflammation, make sure you check out my video on post-inflammatory hyperpigmentation for more information on how to treat it. And there's one more distinction of solitary, kind of like well distinct brown patches on your face that you might see, and these are more common as we age, and these are seborrheic keratoses. They're not your sunspots, they're not flat, they have a little bit of texture, although some of them are what's called macular seborrheic keratosis, so they're completely flat, but if you look with the light just right at a good angle, you can see just a little bit of texture on the surface of the skin. These are yet another completely different entity of their own. Because of that texture that they have in them, your regular sunscreen, exfoliating acids, and retinoids, as well as bleaching creams, are just not going to work on them. They need to be physically destroyed with things like liquid nitrogen or maybe TCA peel. So those seborrheic keratoses, I also call them wisdom spots or birthday presents, we get those on the face as we get older, especially over the age of 50. But what is melasma? Melasma is a completely different story. It's a chronic pigment disorder that's much more stubborn, and it's influenced by a variety of triggers and not just the sun. It usually shows up as more of a larger blotchy patches of pigment with like blurry or uneven edges. Unlike your sunspots, which have very well-defined borders, melasma is not like that. It's often symmetrical, so you can see on both cheeks. It can also show up on the upper lip and the forehead. These are some of the most common patterns of melasma. Melasma is driven by multiple internal but also external factors. These include things like hormonal changes like pregnancy, birth control, or hormone replacement therapy, UV exposure, but also things like heat from the sun, saunas, hot yoga, or even the kitchen. Other things that contribute to melasma are things like inflammation or irritation, but also visible light if you're just sitting next to your window, or visible light from screens, or even indoor lighting like I have in front of me right now. Melasma is more stubborn, and it tends to involve deeper layers of the skin. It can improve with treatment, but it tends to come back without like an ongoing maintenance. So this is not a condition you're going to fix. It's something that you rather manage over time. If you think you have melasma and you want to know how to treat your melasma, I'm going to go ahead and link up my melasma video here where I go into specific products over the counter and steps you need to do at home to help manage your melasma. So how do you really tell the difference? Is it melasma? Is it a brown spot? And which procedure should you be doing? Even though brown spots and melasma come from completely different causes, they can look very similar, especially to an untrained eye. As a dermatologist of 15 years, some sometimes it's even difficult for me to tell if I'm just looking at one spot. And that's why it's important to look at the entire picture. So you want to make sure you check both sides of the face, check the sides of the neck, check most common areas and see if that pigment is more diffuse or is it just solitary. It's also important to take proper history. When did this start? How long has it been there? Does it flare with sun? Are you on birth control? And because this is so difficult to diagnose, many people end up using the wrong treatment. One clue is how the pigmentation behaves. If the spot fades a little, then returns darker after sun exposure, heat, or even around your menstrual cycles, or if you start birth control, that's a strong sign that it could be melasma. Brown spots usually don't fluctuate that way. Also look at the pattern. Brown spots are typically random, isolated, well-defined, really easy to see. Melasma, on the other hand, often shows up symmetrically, so on both sides of the cheeks, both sides of the forehead, or like upper lip or corners. But here's the thing, even with those clues, you can't always tell you on your own. So this is where it's important to see a dermatologist who can really look close and see the difference. We can often tell just by examining your skin in person, and if needed, sometimes we can use tools like Wood's lamp or dermatoscope to see how deep the pigment goes. That helps us choose the treatments that are going to be effective and safe for your skin. And here's where things can go really wrong. Let's say you assume it's a sunspot. You try an at-home chemical peel or you book an IPL session hoping to fade it fast. But if the pigment's actually melasma, you just exposed it to heat, light, inflammation, three of its biggest triggers, which in turn, it may look like it's gone for a little bit, but when it comes back, it likes to come back with vengeance. And I have seen this in my clinic so often. It is so important to know that if you have melasma, it is that darker, deeper pigmentation, and it can and will rebound after irritation, heat exposure. It becomes darker, more widespread, and harder to treat. So now instead of fading, the pigment can become more intense or take on like this blue-gray or almost muddy-looking appearance if it sinks into deeper layers of the skin. This is known as dermal melasma. So that IPL treatment that you thought faded your melasma for a little bit just made it harder to treat. Next, once melasma is inflamed or deepened, it can become less responsive to topical treatments, and it can take much longer to improve even with the right regimen. Some cases become chronically recurrent, meaning the skin stays in a state of like persistent hyperpigmentation. I've seen patients coming in feeling defeated, thinking like they're doing everything right, but they've been treating the wrong condition from the beginning. Even the best product or procedure in the world will not help it if it's the wrong diagnosis. In fact, you could push it further from the results that you want. That's why this distinction is really important. It's not just about the diagnosis, it's about building the right plan from the beginning. I hope you found this helpful. This is so important. I see in clinic every single day. Let me know what questions you have about melasma or pigmentation in general. As somebody in my 40s who suffers from melasma, I'm very passionate about this topic and would love to answer your questions. Or if you have other future topic ideas, let me know below. Also, don't forget to follow me on Instagram and TikTok at Dr. Aleksandra Brown. If you found this video helpful, make sure you hit that like button and subscribe to the channel for more skin, hair, nail, and perimenopause tips. Thank you for watching. I'll see you next time.